This is Modern Dental Assisting, Chapter 59, Dental Sealants. Dental sealants is a clinical procedure to apply a thin coating of dental material to the pits and fissures of posterior teeth. This will help prevent cavities. Dental sealants represent one of the greatest advances in modern dentistry. Studies have shown that placing sealants are 100% effective in preventing development of caries in sealed tooth surfaces, so long as they are placed properly. How sealants work. Bacteria accumulate in the narrow pits and fissures. Even a single toothbrush bristle is too large to enter and clean these pits and fissures. Enamel at the base of the fissure is thinner than the rest of the tooth, so the sealant then acts as a physical barrier. When would we use a dental sealant? Well, we could use it with a patient who has poor oral hygiene, maybe a patient who's at a higher risk of caries. If our patient has a lack of exposure to fluoride, one with a high sugar diet, if we see some dental defects, underlying systematic diseases, if our patient is taking medications that affect the oral environment, and on fully erupted teeth. When we wouldn't use a dental sealant is when a patient has a lack of pits and fissures, already has decay on the occlusal surface. We wouldn't use this on interproximal decay, insignificant eruption of the tooth, or a soon-to-be lost primary tooth, and in a patient who would have poor cooperation in the dental chair. As far as sealant material goes, we have composite resin and glass ionomers, and these can be filled or unfilled. Method of polymerization. The major difference among the materials is the method of polymerization, or the setting or curing. So we have our self-cured materials. These are chemical cured. They consist of a base and a catalyst, and then when the two are mixed together, that's when the curing or the harden happens. Then we have our light cured material, where we wouldn't need to mix, but we would hit that with our curing light in order to create polymerization. Color of sealant material. Sealants may be clear, tinted, or opaque. Tinted or opaque sealants are more popular because they're easier to see than clear sealants during application, and then also during checks for retention and subsequent office visits. Some brands of sealant material have a tint that's visible during the application, but then turns clear after it's cured. General tips on sealant material: replace the cap on syringes and bottles immediately after use. Do not expose the material to air or light. Do not store the materials in proximity to eugenol-containing products. Most etchant and sealant material are designed to be used at room temperatures. The shelf life of most sealant product at room temperature is 18 to 36 months. Procedure method includes cleaning the surface by polishing, rinse, and dry, etching the surface, creating great isolation, and then placing the sealant. Troubleshooting when placing sealants. So the sealant comes off at placement. We need to make sure that we're maintaining good isolation and then re-etch. Sealant blocks interproximal contact area. Use just enough and then remove excess before polymerization. The sealant has holes in the surface. We should be using an applicator or explorer to work into fissures. The sealant is high, interfering in occlusion. We don't want to puddle. We want to check the occlusion and then have the dentist adjust with the burr. Sealant material safety. Do not use sealants on patients with known acrylic allergies. To reduce the risk of an allergic response, minimize exposure to these materials. Use protective gloves and a no-touch technique, and always wear protective eye gear.